everybody. Better Spaces is a health and happiness solution for today's hybrid workplace. My name is Dr. Paul Kachoa, and I'm a physical therapist in order of PAR5 Physical Therapy here in Randolph, New Jersey, and I partnered with them to bring you today's easy and educational workday session. So today's session, we're going to talk about stretching for tennis and pickleball. Some of the sports that are very similar but different. We got a net, we got a paddle, we got a racket, we got a ball, we got people that we're going to be hitting across the net from. So we're going to talk about how can we stretch and warm up properly for those two types of sports, those racket sports. So a little bit about me. I received my doctorate of physical therapy from Mercy College and my undergraduate in exercise science and sports physiology from Rutgers University. I've been a physical therapist for over 20 years, and I specialize in orthopedics. I'm an orthopedic clinical specialist and a certified golf fitness instructor from the Titleist Performance Institute. So today we're going to learn the three key stretches on how to avoid aches and pains with pickleball and a quick little warm-up routine to improve your game. So let me just kind of pull up my slides here. So stretching for tennis and pickleball. So an important note, every one of my sessions here, because I'm a physical therapist, I have to put this disclaimer up that the stuff that we're going to be talking about today is aimed at the general population. So it's useful tips, but if you're dealing with something specific, you want to make sure that you get a customized and individualized program and treatment from a medical professional. So seek medical professional help if you're dealing with a specific problem. All right, so if you don't take anything away from this little talk today, this slide is probably the most important because it's the root cause of what causes injury and everything else, these aches and pains and movement dysfunctions. Basically, the body functions this way, on this pattern of alternating stability and mobility. If it's broken, then we've got issues. We've got pain or injury. All right, so here's a video to kind of illustrate this, going from the bottom up, from the foot, ankle, hip, knee, hip, lower back, mid-back, shoulder, scapula, what else we got? Elbow. So this pattern here of alternating of a joint needs to be stable and another joint needs to be mobile. So for example, we're going to be talking about the knee today. The knee is a very simple joint. It needs to be stable. It cannot be like wonky and unstable, right? Who wants an unstable knee? It's a simple joint. All it does is just bend and straighten. It likes to bend and straighten and to move in one direction. If there's any rotation or instability there, then that's when you get pain. And typically when the role of a segment isn't there, or it gets reversed, like if the knee becomes a mobile segment, then that occurs because of the joints above or below have also reversed their role. For example, for the knee, if you're having knee problems, I always look at the ankle or the hip. So if you have a tight ankle, if your ankle is not as mobile as it should be, or the hip is not as mobile as it should be, the knee, which is the joint in between, will typically try and take up the slack, do more than its job, and becomes a mobile segment. So it reverses its role, and then we have pain or injury as a result. The other joint that we're going to be looking at today is the shoulder. So shoulders need to be mobile, the shoulder joint, but the shoulder joint is also connected to the shoulder blade, the scapula, and that needs to be stable. So we talk about, you've probably heard about the rotator cuff. The rotator cuff starts on the scapula, the shoulder blade, and holds that ball of the shoulder joint in this middle of the socket. If that ball is moving around as you're moving your arm and it doesn't stay in the middle of the axis of that joint, then typically we do get pain. Or the other part is that the muscles that connect the shoulder blade to your trunk, to your ribs, your spine, your neck, those muscles aren't moving well and your shoulder blade is not stable. If it's an unstable shoulder, then typically unstable scapula, the shoulder blade, then the shoulder will have pain. All right. So let's kind of dive in a little bit closer here. So the shoulder joint is basically three bones stuck together here. We've got the collarbone, the collarbone, and the shoulder blade, and then the humerus. So all of these joints here, they need to be moving well and in a coordinated, well-timed manner so that you don't have shoulder issues when you're doing a forehand, backhand, or specifically overhead smashes. So that space there, if you look at the slide here, the acromioclavicular joint, that's basically where the collarbone meets up with the shoulder blade. That creates relatively the roof of the ball and socket. Now, the humerus, which is the arm bone, that ball isn't round. It's got a big bump on the outside of it. You can probably see it in that picture right there. If that big bump comes up against that acromioclavicular joint or AC joint, that's when we get impingement issues and shoulder pain. That's usually represented as like a pain, a diffuse type of pain that's on the outside of the shoulder or in the front or like right up on top. So depending upon where the pain is, that doesn't necessarily mean that's exactly the problem, but that's something that I commonly see when we get impingement issues as the ball comes up against the top of the socket. All right? And then the knee here, the knee, we've got the femur, which is your thigh bone, and then the tibia and the fibula, which is your lower leg bone. Primarily, the femur, leg bone, comes in contact with the tibia, and then we have the meniscus, and then we have the patella, the kneecap in front here. Again, it's a very relatively simple joint compared to the shoulder. All it does is just bend and straighten. You want to make sure that it bends and straightens in the axis of the joint and not introducing any type of rotation. There's a little bit of rotation that happens in the knee, but we don't like it to be uncontrolled. All right. So what we're going to go through is some shoulder stretches, some knee stretches, some ankle stretches to prevent you from having injury or pain, or also to improve your ability to move and improve your performance. So these are some of the stretches that we're going to go through: open book, shoulder flexion, shoulder external rotation stretches, and then some hip flexor, quad stretch, and ankle dorsiflexion stretch. Okay, so let me pull up my different camera here, and then I'm going to make sure that I have my list out. We've got camera 2 right here. The first thing is called an open book. So the open book is basically when we're trying to increase thoracic or mid-back rotation, so you keep that segment mobile so we don't have shoulder issues. So I'm going to kind of pan this camera down so you can get this bird's eye view, and I'm going to kind of go back, and we basically lie down on the floor. Hopefully we can get it on both cameras here. We're going to lie down on your side. We're going to bring the knees up, and then that rounds out the lower back. And if we round out your lower back, that locks that out from rotating because we want to isolate this move to the thoracic spine, the mid-back. So the bottom hand is going to keep those knees together. And then the top hand is going to reach forward. That rotates the shoulder to rotates my trunk, my thoracic spine to the left. And then I take this up and back and I rotate the other way. So now my torso, my thoracic spine, is rotating to the right. So I just kind of go forward and backward through this move here. You can kind of put a pillow if you want underneath your head, but this is basically the open book, kind of opening the thoracic rib cage area, and we're opening that book and we're closing it. And typically what I have people do is do this for about a minute to 2 minutes. All right. And then the next one we can do is work on shoulder flexion, getting this movement overhead. And you can kind of take your racket. I don't have a racket here with me, but let's kind of pop this up here. I've got like this stick, which will represent my racket or my paddle. And you could take this into an overhead position. I'll show you the side view as you push through the opposite arm up overhead. So the big thing is that with the mechanics of your shoulder, we want to make sure that we get as much space in that socket as possible. So what we want to do is as we come up, we want to make sure that the elbow doesn't wing out and it doesn't bend, and we're not coming up like this because, again, this will create that impingement in the shoulder that we mentioned earlier. We want to create external rotation. So I'm going to rotate my hand here, keep my elbow pointing down, and I've got my racket, got my stick or whatever, and I'm going to bring that up with my thumb side up into the air. Okay, so that's going to give me my shoulder flexion stretch. And I could take this at various angles, going out to the side, adding a little bit of rotation here, like we did on the open book test, stretch. But this is one of those shoulder stretches that I like to do afterwards or before we go to play, just to warm up that shoulder. All right. Another one is an external rotation stretch. So basically, external rotation is this way. We want to have enough range of motion into this position so that when we do go overhead with our smatches or we're reaching out to the side, that we have enough range of motion and flexibility through there. So one quick and easy way is to grab the wall. I'm going to put my hand, and this could be a fence if you're at the court here. Just put my palm on there, and again, if you could notice, I'm putting my thumb and fingers pointing backwards behind me. So that forces my shoulder, and again, what we call external rotation. So I'm going to put my hand there, keeping my shoulder externally rotated, and my shoulder is back. I'm not letting my shoulder kind of pop forward like this and get close to my ear. So I want to keep that shoulder away and down from my ear. Again, that focuses on external rotation, creates a better shoulder position. And then I just kind of turn my body. As long as I position my body, I'm taking a step here, and I'm rotating my chest, my torso away from where my hand is. I'm going to get this stretch through here, a little bit of pec and shoulder, and then that externally rotated position here. Now, we could do that. So these stretches that we're holding, we're going to hold for at least 30 seconds. The ones that we move, these dynamic stretches, we're going to go for about at least a minute to 2 minutes. The next stretch I want to get into is going downstream into the hip. You want to make sure that your hip flexor is as flexible as possible so that the hip can function, the glute can function properly, and there isn't as much stress on the kneecap as, you know, we can kind of reduce the stress on the kneecap when we do this stretch. So we're going to get into this half kneeling position. This half kneeling position, I'll show you from the side view here, is a pretty classic hip flexor stretch. Maybe a lot of people have done it. You could pad your knee by putting something underneath your knee. But the main thing is that as we're trying to stretch out this whole front musculature in this hip area, it crosses several joints. It starts on your lower back, these muscles, the hip flexors, and it dives through the abdominal cavity and inserts into the front part of the femur, the hip. And what happens is that a lot of times people will get into this stretch and take a wide stance and just kind of go into like this. So yeah, I feel that stretch. And we wind up searching for this stretch and going through a larger range of motion than we have to because we're not keeping, the most important thing with these stretches, we're not keeping the attachment points of that muscle as stable as possible. So if I'm going to pull, let me get my super band out here to show you. If I want to stretch something, this is a rubber elastic exercise band. If I'm going to pull this end and I don't keep this end stable, what happens is I'm just going to kind of just come along like this. I have to keep both ends stable and then move one end, and that creates the stretch. So when it comes to the hip flexor, the first thing that we want to do is make sure that we stabilize the pelvis. You keep the glute on. So this butt cheek muscle, this right butt cheek muscle right now, I'm going to try and squeeze that as hard as I can. And what that does is that it tilts my pelvis underneath me, and that stabilizes the pelvis and the hip. And then now I want to stabilize the trunk, the lower back. So I'm going to keep my abdominals on, kind of bring my rib cage down so that my lower back doesn't arch. You can see the difference there. And then if I keep those two muscle groups on, I can go into the stretch as I bring my hip forward. I encounter the stretch early in the range of motion versus when we had everything kind of relaxed. And I let everything kind of go like that, and I just went into that. So we want to try and be stable as we get into the stretch. And again, this is a static holding stretch. We're going to hold that for 30 seconds. And the big thing with this is that as we get into here, I could show you the other side here, is we can get into the static stretch and do a dynamic torso rotation stretch upstream or above the segment that we're stretching. So this is a little bit of advanced maneuver here. We want to try and keep that pelvis tilted, glute on, abdominals engaged, lower body as still as possible, and then we can kind of take our racket or our paddle and kind of do a little bit of rotation here to warm up the upper body and the abdominals more. But I have to be stable downstream. So I'm getting a static stretch down low in the leg, and I'm getting a dynamic stretch through my torso and my mid-back. So that's a little bit of a variation to the hip flexor stretch so you can include to help prep for your games or your practices. The other thing that we're going to go through is working downstream into the quad stretch. The quad stretch is a pretty classic stretch. You probably have seen this before. You just grab the ankle. You could hold on to the wall or some type of stable surface, and we kind of just bring the knee in like this. The big mistake that I see with people is that they tend to have this knee out, and forward, and they start to try and get the stretch. So if I show you from the front, we want to have this stretch where the knee doesn't hang out like this. Okay, so that means that we're just kind of going through and giving that tight lateral quad slack. So we're not giving that stretch where it should be. All right, and that creates, again, fosters this rotation that can happen in the knee joint that we don't like. So we want to make sure that when we get into this pulling, this quad stretch, we keep the knee, hip, and shoulder in line. And when we pull that back, so we want to make sure that the knees are as close as possible as we get into this stretch, and then we bring the hip, bring the ankle to the hip. So here's a side view. I'm grabbing my ankle here. I'm bringing my knee backwards, but I keep my knees close together. Here's a front view. Here's a side view. And the other thing too is that, again, these muscles that we're stretching, the quads, are attached to your pelvis. We want to make sure that the pelvis stays stable. So we're going to do the same thing that we did for our hip flexor stretch. Try and engage the glute if you can. So squeeze the butt muscle, and then that should turn up that stretch for the quad. All right, moving downstream, the biggest one, and this is where the money is made. If you want to protect your knees, we want to make sure that your ankle is as flexible as possible. All right, so there's this movement called dorsiflexion, like this, right? Moving the ankle up. We want to be able to kind of have enough freedom of motion for that position to happen in the ankle, so that when we're lunging or split stepping, that we have flexibility of the ankle and we reduce the stress at the knee. So to do this, I'm going to take my shoes off. This is a pretty classic and easy one. You probably have seen something like this. We get into a calf stretch. We're like here and then here, and I'm going to bend my front knee to stretch out my calf. All right, pretty straightforward. The big thing with this is that as we go into this static stretch, holding it for 30 seconds, we have to make sure that our points of performance, our technique is on line here. The back foot that we're stretching or the ankle that we're stretching cannot be turned out. So if I'm looking here right at the camera, a lot of times people will stretch this way to get into the calf muscle and then have that back foot out like that. Okay, so then you lose the stretch. This is fostering or enabling this faulty movement mechanic where your knee moves in a different direction than your ankle and your foot. So we want to make sure that we're stable with that foot, winding that foot totally straight. And then as we bend this front knee, we should get that easy little calf stretch. Here's the side view. So I'm driving my heel down into the ground. I could hold onto the wall or something like that, driving my hip forward, keeping that foot totally straight. There's two muscles in the lower leg we need to stretch. We stretch one, the gastrocnemius, with the knee straight, because that muscle crosses the knee. There's another muscle in the lower leg called the soleus that does not cross the knee. And for that, everything is the same setup, but we do it with a little bit of a knee bend, and then we go into that stretch holding that for 30 seconds. So this is the side view with that soleus stretch, partially knee bent. And if I show you from the front, we don't want to have this foot turned out. We want to go totally straight. My knee is partially bent. I'm bringing my hip forward, and then I'm going in to hold that for 30 seconds. Okay? So another one that I like is using a vertical surface like a wall. It could be, the fence or something like that, is to get your ankle and foot into this position. Hopefully you could see, there we go, from the side view, that I have my heel locked onto the ground, and I have my foot elevated as high as I can, my ball of my foot, my big toe, up on this wall. And then what I do from here is, keeping that foot pointed straight ahead, is I'm going to push my knee forward. And as I repeatedly do this, so this is dynamic stretching. We want to do this for about a minute or so, just kind of going into that. That's going to help mobilize that ankle joint. A loose and mobile ankle joint reduces knee pain. All right? So we want to be able to do this and get into this position where your foot is elevated like this with the ball of the foot up on that vertical surface of that wall, and then we're going to push that knee forward. All right? So those are some key stretches that you can do for your pickleball or tennis prior to your round or after. Now, this is the big thing too. With stretches, there's two types that we went over today. We went over dynamic stretching, where we're moving around, and passive stretch or static stretching, where we held a position for 30 seconds. You got to hold those stretches, the static stretches, for 30 seconds. If anything shorter, that tight muscle just kind of rebounds into a shortened position, and then we lose that elasticity. So we have dynamic stretching and static stretching. Dynamic stretching should be primarily done prior to activity, and then static stretching should be done after. So that 30-second hold, those longer stretches we do after activity. The reason we do that is because static stretching has been shown to temporarily reduce the ability for a muscle to create force or the strength of the muscle. So we don't want to go into our activity weak. So we save the static stretches for after. All right, so we can go over really quick something as far as like a dynamic warm-up routine. We talked about the ankle stretching. So let's just say, for example, you're at the court and you're thinking, all right, I got a match or I got to practice in a couple seconds. How do I warm up? So I've got my paddle. We can do arm circles, forward and backward. Backward is more important than forward. We can go backwards and forwards, doing about 10 to 20 times. So again, this is the dynamic stretching. We talked about rotation through the torso in different positions, right? We can include that calf stretching, lower body stretching with a dynamic upper body stretch. And then we could do leg swinging, where I'm warming up the hip, forward and backward, opening up the quad and the hamstring. We could repeat on the other side. And then we could also do squats. Air squats is basically a good way and a functional way to warm up the lower body, keeping the foot flat. So that's important. Keeping the foot flat as we're doing squats. And then we could do forward lunges, keeping this lead foot flat, alternating sides. Again, kind of mimicking the movements that our body is going to get into if we're going to go after those dinks or those drop shots, or we're trying to do a split step. We could also do lateral lunges, where I just kind of keep one knee straight and then bend the other knee, going in one direction, and then going the opposite direction. There we go. Now we're on camera. And then that way we can kind of warm up our body and get our joints more mobile. All right, so let me go back to my first camera here, and let's see if anybody has any questions. Let me know. You could enter them in the chats or unmute yourself and ask me if you have any specific questions about stuff that you need to do when you're playing tennis or pickleball. All right, great. You're welcome, great. Good to know, Carmen. I mean, like, these are things that I see all the time with stretches, dynamic or static stretches, that your body will move through the path of least resistance. So if your body is tight, a piece of tissue is tight in your body, and you go to stretch it, your body will find a way to get around that tissue tightness and just kind of cheat. And then I'm just not really effective or as specific of a stretch as it should be. All righty. I'm going to give it about 30 more seconds. If there isn't any questions, we're going to close it out for today and let you enjoy the rest of your Tuesday. Hamstrings. Yeah, so hamstrings is another thing. So we did some dynamic stretching for the hamstrings. So this is what we're gonna do prior to our round. If we do a squat, we do a lateral lunge or a forward lunge, that's gonna dynamically warm up our hamstrings. We could do this leg swing motion that I just did. That's gonna also dynamically stretch out that hamstring, right? I like doing that prior to the round. If we're gonna do after our match or after our practice, we could go for a static stretch, and that's pretty standard as well. You could be sitting, you could be standing. Basically, put your foot out in front of you, and then you stretch it. Oh, let me show you on this side here. Get you the side view. So here's the hamstring. We're getting this knee straight, and then hip flexed up here. Now, the key things again is that the hamstring crosses the knee and it crosses the hip. We want to make sure that as we're getting into this position, and if you've probably seen this, that classic bending forward. Let me back this up here so you can see. We get the leg out in front, and then we're like, I'm just going to touch my ankle. Oh, there we go, right? Touch my toes. So, and then again, we're going to be searching for that stretch if we're not making sure that the points where that muscle is attached are stable. So what we want to do is, again, keep this pelvis in the right position. For our hip flexor stretch, we had that tilt where the tilt was going underneath us with that glute activation. For here, we want to let the tailbone come out. We're tilting the pelvis forward. So if we tilt the pelvis forward, give a little bit of an arch to our back, and then I kind of tilt my body forward without rounding, that'll give me that immediate hamstring stretch rather than trying to unlock everything and slouch and kind of bend forward through my back and my spine, okay? There's nothing wrong with bending forward from your spine, but we want to do a specific hamstring stretch. We want to make sure that the back doesn't round out like this, and then we're keeping that pelvis in that position so that we can kind of flex forward at the hip and then get that stretch without moving into too much range of motion.